Welcome, and thank you for tuning into the channel. This is a recorded CE session for Lab Director certification. This is the first step to qualification for CLIA Lab Directorship. Stick around until the end for a unique offer. And now, catch the webinar. Let's begin. Okay, so this course is designed for laboratory directors, the CME certification, CMS final rule, December 28, 2024, dictates that to be a CLIA lab director, you now have to have 20 hours of continuation credit in specifically lab director responsibilities. This course will be 10 modules. It will cover 20 credit hours. This session specifically here, module 1 is 1.5 credit hours, and it is approved by the AAFP. So this course is the fundamentals and best practices for CLIA lab directors and satisfies CMS final rule 28. So digging into module 1, it's going to be introductory into the CLIA and regulatory framework. It's going to start an overview of CLIA, what is CLIA, regulatory bodies, as well as compliance resources. First, a little bit of background for me, my professional background. I am a CLIA lab director, currently serving for 4 laboratories. As you may or may not know, you have 5 laboratory slots. I obtained my PhD in forensic science. Specifically, my focus is forensic toxicology. I'm a board certified toxicologist with the NRCC-TC. With the NRCC-TC, as well as combined with having a PhD, that allows me to be a CLIA lab director. If you have questions about that, what it qualifies you as a CLIA lab director, you can ask about that. I'm also a POL manager and a technical supervisor, serving for clinical chemistry, molecular, and toxicology. I'm also licensed for testing in Nevada and Florida. As well as I'm an NIJ research fellow. So what will we be going over today? Today will be module 1, and what you'll learn: the purpose and the scope of CLIA regulations, roles of key regulatory and accreditation organizations, and resources that are available for maintaining your laboratory's compliance. Compliance is a major portion of what CLIA wants. So what is CLIA? CLIA is the Clinical Laboratory Improvement Amendments of 1988. That's specifically when someone refers to CLIA, that's specifically what they're referring to. It was enacted in response to concerns about poor laboratory practices. So this is what initiated a lot of compliance in clinical laboratory settings. It was established in 1988 to standardize laboratory testing quality across the U.S. and to ensure accurate, reliable test results that impact patient care. It applies to all clinical laboratories that test human specimens, regardless of location or size. The purpose of CLIA is to protect patients by ensuring that laboratory tests are accurate, reliable, and are performed in a timely manner. And the overall goal is to improve and maintain quality, safety, and accuracy of laboratory testing in all settings, including hospitals, clinics, and independent labs across the country. CLIA sets a baseline for laboratory quality, focusing on test accuracy, regardless of size or affiliation. And any lab in the U.S. that is performing tests on human specimens for health purposes must comply with CLIA. So who does CLIA cover? All U.S.-based laboratories performing human testing specimens for diagnosis, prevention of disease, treatment of disease, and health assessment. Any type of testing that's done on human specimens for anything health-related falls under CLIA. This includes all facilities such as hospitals, physicians' offices, independent and reference laboratories, and includes nursing homes and mobile labs. So CLIA covers extensive, basically anything health-related in a laboratory setting falls under CLIA. So what are types of testing regulated by CLIA? There's wave testing. This is the most simple thing. The simple tests that require minimal risk of incorrect results. Examples of this are glucose monitoring, oftentimes strip tests. So in this instance, glucose monitoring with a strip, simple blood test, blood drop, urine dipsticks fall under wave testing, things of that nature. Moderate complexity testing requires basic lab skills and training. An example of this are blood counts. This is typically hematology, so counting how many red blood cells, white blood cells, things of that nature are considered moderate complexity. And then finally, there's high complexity. This requires advanced and technical skills and decision making. Examples of this include molecular diagnostics, specifically anything PCR testing wise, NGS, PGX, infectious testing, toxicology with mass spec falls under high complexity. Anything that's not FDA regulated, anything that's a lab developed test will fall into high complexity. So what does CLIA cover? Covers personnel requirements. So defines roles such as laboratory director, technical supervisor, clinical consultant, and testing personnel, as well as specific qualifications, responsibilities, and training requirements based on the testing complexity. So all these roles have different responsibilities and require different qualifications and training based on the testing complexity. There's less training and less responsibility on wave testing, and then a little bit more on moderate testing, and then more stringent rules for qualifications and training for high complexity. It also includes quality standards, specifically quality control or QC, with guidelines for ensuring accuracy and reliability of test results, proficiency testing or PT, mandatory participation in external programs to evaluate test performance, and quality assurance or QA, ongoing monitoring of all aspects of laboratory operations to ensure compliance and improvement. So overall, CLIA wants personnel, quality, and as well as inspection and certification. So it wraps all that in together when it comes to evaluating whether or not a laboratory is maintaining this compliance with inspections and certifications. So it covers the initial certifications, regular compliance by inspections, as well as potential unannounced audits by CMS or other accrediting organizations. Digging into the certification requirements, laboratories must obtain either one of several CLIA certifications based on the type of testing they perform. A certificate of waiver is for labs that are only conducting wave testing. A certificate of compliance is for moderate or high complexity labs inspected by CMS. So CMS is also known as CLIA. So you can apply for a compliance, meaning that CMS will be the one doing the inspection. Or a certificate of accreditation. This is the same for moderate or high complexity labs, but these are accredited by approved agencies. So another accreditation body will be doing the accreditation, specifically, for example, CAP or Joint Commission or COLA. So this is the main types of certificates you'll be seeing as a lab director. There are other ones, but typically those do not require a lab director. So these are the ones that specifically highlighted here because they require a lab director on the CLIA certificate. Also, CLIA covers the test system validation to ensure that equipment and procedures are validated before implementation, and requires ongoing calibration and maintenance to make sure that they're meeting performance standards. So you need to make sure that the CLIA also ensures that your test systems have been validated and that they're using proper calibration and maintenance to maintain those standards, as well as record keeping and reporting. Specific requirements for maintaining test results, QC records, and incident documentation. So CLIA has specific rules for how long you must maintain your records, as well as reporting records, as well as reporting critical values to ensure timely patient care. This is more specific for clinical chemistry. In blood testing, there are values that need to go out instantly within 24 hours or within an hour. But also there are some in terms of infectious testing, some diseases, if they are detected either STIs or UTIs, as well as wounds, if they are detected, especially if they're antibiotic resistant, they need to be reported to the state's health services. Basically, when it comes to CLIA, if it's not recorded, it didn't happen. So it's very important to maintain your record keeping, as well as your reporting. But CLIA specifically enforces those. Important thing also is patient safety. It ensures the accuracy and reliability of tests that directly impact medical decisions. So basically, anything we're testing here falls under CLIA is for health services, diagnostic, or treatment. And so CLIA covers the process from specimen collection all the way through result interpretation, as well as reporting. So garbage in, garbage out, specimens need to be collected safely and securely, as well to maintain their integrity, to ensure that the results are accurate, are able to be reported or interpreted properly, as well as finally a reporting, make sure the reporting is done in a proper way. So focusing in on CLIA, why compliance matters to ensure patient safety. That is one of the biggest things as the CLIA wants, is to make sure that the patient safety is the highest priority. And to do that, they do that through accurate and reliable test results. Compliance is important in maintaining laboratory reputation as well as legal standing, and reduces the risk for corrective actions, fines, or loss of certification due to non-compliance. Those are worst case scenarios, corrective actions, fines coming down from CNMS, or loss of certification, ceasing of testing, things of that nature. So it's important to maintain compliance. So key regulatory bodies. Who oversees CLIA compliance? There's some major actors, including CMS, or the Centers for Medicare and Medicare Services. This is the primary enforcement agency for CLIA compliance. But also involved is the Food and Drug Administration, or FDA. They provide oversight for test systems and devices, as well as the Centers for Disease Control and Prevention, the CDC. They provide guidelines and technical standards, specifically oftentimes, in this instance, for molecular testing, but they do have guidelines for clinical chemistry and toxicology. So digging into the regulatory and oversight framework. So CMS is the primary agency responsible for enforcing CLIA regulations. They issue certificates and conduct inspections for compliance. Shown here is a CMS 116. That's what's filed whenever a lab director takes over a laboratory, or also whenever a laboratory specifically wants to get a CLIA certificate. So when the lab is first created, they have to apply through CMS. And this also, CMS approves accreditation organizations that can certify laboratories. So CMS delegates and gives the opportunity for other accreditation organizations to provide inspections. So CMS does inspections, but they also allow other accreditation organizations to perform inspections, and basically on behalf of CLIA. So when you apply, you say that you're either you want the CMS to inspect you, or you have another accreditation organization that you're going to apply for to inspect the laboratory. So the FDA, they regulate laboratory devices and diagnostic test systems. They assign complexity categorizations to laboratory tests, wave, moderate, high complexity. So basically, the FDA is very important for regulating laboratory devices. So any test system, any extraction, any kit falls under FDA if they're going to be sold commercially for diagnostic purposes. So what that means is any kits that are used, any extraction kits, any instrumentation testing, anything like that falls under FDA unless it is an LDT, a laboratory developed test. So those need to follow those. The laboratory has to express much more detailed information on a laboratory developed test compared to an FDA test. So the FDA submits, or an FDA approved kit or reagent is submitted to the FDA, goes through a rigorous process to ensure that it is effective and safe and reliable. So the FDA goes through, when you submit for an FDA approval, it goes through a long process, weaknesses, matrix effects, all kinds of things, and then it ensures that if the laboratory is using an FDA approved kit or an FDA approved reagent, it has been shown to be safe, effective, and reliable. So whenever you use an FDA approved kit, you often do verification instead of validation. So there's advantages to FDA approved kits, but FDA approved stuff also typically pass down that expense onto the consumer. Because it is expensive and time consuming to get things approved. But that's how the FDA is in regulatory or oversight for CLIA, as well as the CDC. So the Center for Disease Control, they provide technical expertise and training for laboratory and quality improvement. They develop guidelines and recommendations to enhance laboratory practices, as well as they support proficiency testing and quality control standards. So the CDC is more focused on quality and improving the efficacy of tests and the efficiency evaluations. But all three of these agencies work together to enforce CLIA, with CMS being the central enforcing agency, while the FDA and CDC provide specialized oversight. We talk about accreditation organizations, so let's dig into what the role of accrediting agencies are. So what are accreditation organizations? They're independent organizations that evaluate labs for compliance with CLIA and additional quality standards. They offer accreditation as an alternative to direct CMS oversight. So some key accreditation bodies include the College of American Pathologists, or CAP. They focus on clinical pathology, including molecular or genetic testing and laboratory medicine. They are known for rigorous inspections and focus on laboratory and quality management. CAP also provides proficiency testing. They provide proficiency testing specifically for toxicology and molecular genetic testing. They are the leading, I guess, proficiency testing for NGS and PGX testing. So next gen sequencing, as well as pharmacogenetics testing. So they are very involved in those. So oftentimes, if you're going to be testing those, you might fall under CAP accreditation. Next, another popular one is COLA, the Commission on Office Laboratory Accreditation. They focus on physician office laboratories, or POLs, small hospital labs, and independent labs. They specialize in smaller laboratories with emphasis in education and quality improvement. They are a nonprofit organization with dedicated surveyors to do their inspections. CAP, as reference, uses volunteers to perform their accreditations. So they have a very strict manual that is honestly a little bit of interpretation to their inspectors, whereas COLA has dedicated surveyors who go from site to site. So they're a little more consistent and they can offer more education as well as quality improvement. Another key body is the Joint Commission. They accreditate hospitals and healthcare organizations, including their laboratories. They focus on patient safety and integrated quality systems, and they ensure laboratories comply with standards integrated into a broader hospital accreditation program. The Joint Commission doesn't just accreditate laboratories, they also accreditate hospitals and entire healthcare organizations. So the laboratory, for them, is just a piece of what they do in terms of accreditation. For CAP and COLA, they accreditate only laboratories. So in instances where a laboratory may be embedded in a hospital, the Joint Commission might be a popular choice for accreditation body. And finally, the American Association for Laboratory Accreditation, or A2LA. They focus on clinical laboratories, especially those performing specialty and high complexity testing. They provide accreditation for clinical, forensic, environmental, and specialty laboratories. They're recognized for accrediting based on ISO. So they accredit ISO 15189 as well as 17025. They are heavily in the forensic realm as well as environmental realm. So they do multiple more things than just clinical laboratory. Some benefits of accreditation. So why get accredited? It's for streamlined compliance with CLIA regulations. And allows access to the best practices and educational resources. So a lot of these accreditation bodies provide more resources for navigating inspections. So CMS, they do not give much guidance. So when you're inspected by, if you go just compliant, you go just to CMS, they're not going to give you much guidance. They're going to come in, they're going to inspect you, and they're going to just cite what you're deficient in, and then you have to go fix those deficiencies. An accreditation body is more likely to come in with their surveyor, tell you what is wrong, and they have multiple resources to provide resources to improve your processes. Enhance reputation and trust with patients and stakeholders. So when you're accredited, you do boost your trust and your patients, with your patients as well as your stakeholders. While CLIA inspections focus on compliance, the accreditation bodies provide guidance on quality improvement. So the accreditation bodies often focus in on improving your quality, not just making sure that you fall within the rules and the regulations of CLIA. So there's a lot of guidance in there, a lot of instruction, a lot of steering mechanisms in accreditation bodies. It also allows for enhanced quality and safety. So accreditation bodies provide higher standards than CLIA alone. So CLIA is going to be the bare minimum, whereas accreditation bodies go a step above and beyond. They encourage implementation of robust quality management systems, or QMS. So focusing in on quality. The accreditation organizations offer opportunities for laboratories to exceed the CLIA's minimum standards. And it promotes a culture of continuous improvement. It's one of those things you can monitor things consistently and constantly, but if you're not making actions to improve on them, then there's almost no point in even monitoring them. It allows for streamlined compliance. What that means is guidance on meeting and exceeding the regulatory requirements, as well as support for inspections and audits. Oftentimes, these accreditation bodies have specific primers, white pages, accreditation manuals, validation manuals, all kinds of things to provide help to make it through inspections. They also have guidance for internal audits. So they have a lot of support for inspection and compliance. This leads to fewer deficiencies due to proactive measures. So the more proactive you are with your compliance, the less likely you are to run into deficiencies. So as I said, they provide multitude of training and educational resources. So you have access to expert materials, technical support. You can often reach out to your accreditation body and they will give you guidance. So you can actually reach out to your surveyors, reach out to staff for these accreditation organizations, and they'll give you input, they'll give you feedback, as well as provide regular updates for regulatory changes and best practices. COLA's been harping on these change in the final rule that just came out on personnel. They've been providing podcasts, they provide primers, they provide alerts, PDFs, they have COLA Central, they have their own COLA teaching resources. So COLA specifically is very big on education. CAP has a good amount of education. They have a training manual and an audit manual as well. And they allow the whole purpose of doing these things into making accreditation better and to making compliance is to have operation efficiency. They help labs identify inefficiencies and streamline workflow. So the whole purpose of improving quality is to make things better. So when you make things better, it becomes more efficient. And they encourage adoption of standardization of policies and procedures. So the more you have standardized your SOPs and more standardized, they more follow general lab practices, the better things are. Accreditation is the gateway to excellence in laboratory operations. So it's the best of both worlds. So when you're accredited, you get a lot of support, and then you still meet the minimum CLIA requirements, as well as it often boosts your efficiency and makes things overall better. So some resources, some ways to stay CLIA compliant. The CLIA website, the CMS, it has a lot of information on there. It's comprehensive information on regulations, certifications, as well as updates. And that's where you'll find a lot of your application forms and find some guidance documents as well as FAQs. There are some state-to-state variations. Some states require more than others, and the CMS has information for that, as well as the CDC's laboratory quality resources. They have training materials, guidelines, and tools for quality improvement. CDC is focused in a lot on quality, as well as training. And proficiency tests providers. This required for moderate to high complexity labs, though it is recommended for wave testing to have proficiency testing. It is not required. Some examples of proficiency test providers are API, or the American Proficiency Institute, and CAP, College of American Pathologists. API has a ton of clinical chemistry, so it has a ton of blood resources, blood, serum, urines, as well as infectious testing, UTI, STI, and wound, as well as non-fungal. CAP has a lot of toxicology resources. API has some toxicology, some urine drug screen, but CAP has way more focus in on toxicology. They do provide proficiency testing for forensic toxicology labs. They do accreditation for forensic toxicology labs. They also, CAP has NGS and PGX proficiency testing, whereas API does not. So the higher level complexity of molecular CAP has that. So you may have multiple providers. If you're a larger reference lab or in a hospital setting, you might have multiple proficiency test providers, as well as professional organizations. A few examples are the American Society of Clinical Pathology, or ASCP, and the American Association for Clinical Chemistry, or ACC. These offer networking and certifications, as well as ongoing education. So it's important to maintain your continuing education credits, as well as your professional organizations. Some states require to be certified or to be members of organizations as part of their compliance, as part of certification. Texas does not require certification, but states like Florida, California, New York, New Jersey, they all require certification. So it's good. It's just good to have certification under your belt. Even when it's not required, it does provide networking and certifications, as well as ongoing certification. Okay. All right. So that's most of the presentation. Now we're going to have some questions here. So let me see if I can get this. So what is the okay, just give me 1 second here. I'll give you some time. So what is the primary purpose of CLIA regulations? So I'll give you some time. You can drop an answer in the chat. Trying to have a poll here. I'm trying to do a poll. There we go. All right, so we launch this poll. What is the primary purpose of CLIA regulations? So drop a vote in the poll here, and I'll give you a couple minutes, couple seconds to go over this. I have to step out for just 1 second. Answer the poll question. And then we'll continue. All right. We got just about all who's gonna pop in. So what is the primary purpose of CLIA regulations? To ensure laboratory safety, to ensure accuracy, reliability, and timeliness of lab results, to regulate the cost of laboratory testing, or to manage laboratory personnel policies. And it is B, to ensure the accuracy, reliability, and timeliness of lab test results. Dun, dun, dun. All right, next one. For organizations, which organization is primarily responsible for enforcing CLIA regulations? Second poll question here. Is it A, CDC, B, CMS, C, FDA, or D, state health departments? They're pretty easy. All right. What do we got? A, B, C, D. We have a winner. All right. So one person said CDC, two people said CMS. It is CMS. Dun, dun, dun. B, CMS. All right. So CDC is typically for quality and research and testing. CMS is the core enforcer for CLIA. All right. You're opening a lab to perform whey glucose testing. What CLIA certification would you need? So we discussed A, certificate of waiver, B, certificate of compliance, C, certificate of accreditation, or D, certificate of registration. One of these we didn't even discuss. So we got certificate of waiver, certificate of compliance, or certificate of accreditation or registration. This will be the last quiz. Promise. What do you guys think? Waiver, compliance, accreditation. It is certificate of waiver. So glucose testing is waived. So you only need a certificate of waiver. Now, would you need PT testing for that? All right, summarizing what we've learned. Let's go back over. Purpose of CLIA is to ensure accurate, reliable, and timely testing. It applies to all US-based labs that test human specimens for health-related purposes. CMS is the primary enforcement and certification agency. FDA oversees the test system and assigns complexity. And the CDC provides training, guidelines, and technical support. The accreditation organizations offer oversight, support, and quality improvement resources with key organizations including CAP, COLA, and the Joint Commission. So CAP is known for their rigorous inspections and focus on laboratory quality management. COLA specializes in smaller laboratories with emphasis on education and quality improvement. The Joint Commission ensures laboratories comply with standards integrated into a broader hospital accreditation program. And ATLA are recognized for accrediting based on ISO standards. So to break it down a little bit, CAP, COLA, and Joint Commission and ATLA, they have very specific case scenarios. Now, at any point, if you're more comfortable with one, you can choose one, you can choose whatever. But they are tailored a little bit towards more specific testing. So CAP is more tailored towards NGS, PGX, or other advanced molecular diagnostics. So if you're going to be testing NGS or PGX, oftentimes you're going to fall under CAP accreditation. Or if you have a combination of forensic testing as well, then you might fall under CAP. COLA is more targeted to physician office laboratories or POLs, small hospital labs, and other independent labs. COLA is more focused on what I am dealing with because I am a POL manager and I also have small independent labs. So I have a lot of familiarity with COLA, but I have previous experience with CAP. The Joint Commission is focused in on larger hospitals with labs integrated into a total healthcare system. So the Joint Commission, as I said before, accreditates entire hospital and healthcare systems. So they aren't just laboratories focused. So they're going to be more integrated, especially if you have nurses and doctors that come in on a regular basis dealing with that kind of patient care, then the Joint Commission is going to be a better situation. But if you are trying to open up a POL, the Joint Commission might not be the best route to go. And ATLA are labs performing specialty or high complexity testing, especially with multidisciplinary settings such as forensic or environmental reports. So ATLA is much more better with handling different specialties. So if you have multiple different specialties and very complex testing, ATLA might be it. So the same with kind of CAP with forensics. ATLA does environmental. So if you have a setting where you're doing clinical testing, but you're also potentially doing some kind of environmental testing, ATLA might be the best bet. So really, these accreditation organizations all kind of have their own niches per se. So they are more valuable in certain instances compared to others. So you really have to weigh your laboratory's needs, kind of evaluate based on that. Last things are prompts. So accreditation organizations. What accreditation organizations do your lab use? So you, in your instance here, you guys are in lab settings, or if you've been in lab settings, what accreditation bodies do you guys use? So from our list here, we had COLA, CAP, A2LA, as well as the Joint Commission. Does anyone know what their accreditation organization is? And they worked in a lab with an accreditation organization. Or was there an organization from our list here that you hadn't heard of, that you weren't unfamiliar with? So for me, since I came from a forensic background, the Joint Commission was a new organization for me, when I was popped into clinical. I had not heard of the Joint Commission. E2LA. That's good, good, good. COLA. But yeah, I hadn't heard of the Joint Commission. That was a new one to me. I vaguely heard of it, but I really didn't know much about it. Environmental, yeah, it sounds like E2LA. But I knew about it, knew about CAP and COLA and A2LA from forensics. ANAB is a big forensic organization, accreditation body. ABFT, ANAB accreditates using ABFT now, or ABFT accreditates. Yeah. So I'll now open up the floor to any questions. If you guys have any questions or things you're interested in. I don't think anybody posted any questions. I didn't I even have to read the question. Anyways, now's an opportunity for you guys to ask any questions if you have it. DSC Q&A? Anyways, if you have any questions, now is the time to drop in the chat. If you end up watching this recording, drop a message in the comments. Drop a chat in there. If you have any questions, I'll answer them in the next session, or I'll answer them in the comments. Either way. Another end survey. I'm very smart. Okay. All right, guys. If there's no questions, we're just going to coming up. Module 2, roles and responsibilities of the lab director. First, in the comments, in terms of accreditation organizations, drop a comment for which accreditation organization does your lab use? Or was there an accreditation organization in the presentation that you hadn't heard of? Comment below. Introducing the Lab Director CME certification. This is continuing education credits required by CLIA to be a lab director under CLIA. So the new final rule, December 28, 2024, declared that necessary for 20 hours of CE credits specifically in lab director responsibilities. This course covers that. There's a link to the course in the description with also offer code 20% off. So use this code right now. Use this link in the course description to get a 20% off, 20% discount right now, and join us. So module 1 has been presented. You can find that once you to select the course, you'll still be able to see it. So it's been presented, but we have the saved presentation for you to view. And we have module 2, roles and responsibilities, coming up real quick here on December 29th. Module 3, personnel management competency, on December 31st. Module 4, implementing quality management systems, on January 3rd. Module 5, quality control and proficiency testing, also on January 3rd. And Module 6, validation and verification of tests, laboratory test systems, on January 3rd. January 3rd is a big bulk day, but then we have Module 7 on risk management and laboratory safety and protocols on January 8th, followed by Module 8, audit preparation, inspections, and continuous improvements on January 11th, and Module 9, end-to-end residual responsibilities in the lab on January 12th. And wrapping up with the lab management simulation for Module 10 on January 15th. So be sure to click in the course description for the 20% off and join us and be compliant for CLIA's final rule for lab directors. So if you're new to lab directors or you're an existing laboratory director that needs continuation credit, check out this course.